Men's health is important, but can easily be overlooked as men are sometimes less transparent about how they're feeling. Staying up to routine screenings and physicals and having an open and honest relationship with your doctor can help. Dr. Conrad Tobert is a urologist and men's health physician at Corewell Health. He joins us now on Wellness with Wood to talk more about some important reminders for men in terms of living their best lives and staying healthy and active. Doctor, thank you for joining us.
Thank you for having me.
So what are some of the most important screenings for men, and at what age should they be done?
That's a great question. As a urologist, I like to focus on the screenings that I perform, but it's also important to not forget the other elements of screening that should be done. And that is something that I always encourage men to talk to their primary care provider about. That includes screening for colorectal cancer, screening for heart and lung conditions, and other issues that like diabetes that should be addressed on a yearly basis. When it comes to prostate cancer screening, something that is near and dear to my heart as a urologist and someone who treats prostate cancer regularly, that is a screening test that can be done with a blood test, usually recommended to start in the ages of roughly 55 or earlier, depending on patient's risk factors. And that can be done just with a non-fasting blood test.
Okay, and how common is prostate cancer? What's the best way to avoid getting it?
Great question. Unfortunately, prostate cancer is so common. Depending on the study you read, it can be up towards to 1 in 6, sometimes even more than that. And also other risk factors make it more common. Patients who have family history have higher rates of prostate cancer diagnosis. And unfortunately, patients who are African American also have a higher rate of diagnosis compared to the rest of the population. But it is something very common.
Yeah.
People have looked for the silver bullet to prevent it from occurring less rapidly or less frequently, and unfortunately, nothing's been found. A heart-healthy diet has been one of the best tools to prevent and keep prostate cancer from, proliferating. But nothing more than a heart-healthy diet to keep people healthy and active.
Yeah. So how often should men get a physical done, and what comes with a physical? What kinds of things happen during that appointment?
Yeah, great question. So certainly men in their middle ages, mid to late 40s, should be having a yearly physical with their primary care provider. And when it comes to prostate cancer screening, doing a PSA blood test once a year is a very important and recommended test to be done. Again, it's a non-fasting blood test and can be drawn with regular labs that could be done with other testing. And it is also recommended that a digital rectal exam with a finger to feel the prostate is also recommended yearly to assess for potential tumors that could be palpated.
Okay. Anything else we should keep in mind when it comes to men's health?
I think it's something that is much more common than people appreciate. And it really starts with an honest dialogue with not only your doctor, but your family members, your relatives. What conditions are they struggling with? What conditions, whether or not it's a mental health issue to a physical diagnosis of cancer or high blood pressure or diabetes. Talking to family members and your primary care provider and being open about symptoms you might be having is important and can help catch things early, because we know that the earlier we catch anything, whether or not it's prostate cancer or another disease, it can be better treated, and people can move past the diagnosis as opposed to potentially struggling with it lifelong.
Yeah, Dr. Conrad Tobert from Corewell Health, thank you so much for talking about men's health with us today.
Thank you.